Ladies and gentlemen, good morning and welcome to Deakin University. My name's Matthew Clark. I'm the Deputy Vice-Chancellor for Research and Innovation here at Deakin, and it's my great pleasure to welcome you all this morning. I begin by acknowledging the Wurundjeri people of the Kulin Nations and pay my respect to their elders past and present, and thank them for their care of the land, air and waterways on which we meet and gather today. We're here to talk about Medicare. It was established 40 years ago when it was introduced by the Hawke Labor government. It is obviously a health policy, but it's also a social policy and an economic policy. And it is appropriate to look at Medicare after 40 years through each of those lenses, and we'll do so today through various presentations. But it is also appropriate to consider it through a historical lens, particularly today as we celebrate 40 years of its existence. And so therefore, I'm very pleased that this event today is being organised by Deakin's Centre for Contemporary Histories. And I acknowledge the leadership of Associate Professor Carolyn Holbrook, who is a member of the Centre for Contemporary Histories, but also Director of the Australian Policy and History, who is hosting this event. Deakin University is very proud of the work we do across the humanities and social sciences. And I note in the last Leiden global rankings of universities that Deakin University is ranked third in the country in the social sciences and humanities. And as we'll see today, across the course of all the presentations, humanities and social sciences are extremely relevant to contemporary Australia. And I know, Minister, as an arts graduate, you'll be well and truly in agreement with that. And so it is with great pleasure that I do now introduce the Commonwealth Minister for Health and Aged Care, the Honourable Mark Butler. Minister Butler is Deputy Leader of the House, and he first served for Minister for Ageing and then later Minister for Mental Health in the Gillard governments. He's held ministerial responsibility for housing, homelessness, social inclusion, climate change, water and the environment. And then prior to entering Parliament, he worked for more than 15 years with disadvantaged workers and community members with United Workers Union. Minister is also an author of 2 books, Advancing Australia, The Politics of Ageing, published in 2015, and The Climate Wars, published in 2017. So, Minister, it is wonderful to have you here at Deakin University as we consider the 40th anniversary of Medicare in Australia. So please join me in welcoming the Minister for Health and Aged Care, the Honourable Mark Butler. Thank you.
Well, thank you for that introduction, Matthew, and thank you to Deakin for hosting us today. I'm also a graduate of Deakin University. I'm not sure how many graduates Deakin has in the cabinet, but I'm certainly one, and very proud to be so. So thank you for that. Obviously, can I begin by acknowledging the traditional owners of these lands, the Wurundjeri people of the Kulin Nation, and thank them for their custodianship of these lands and pay my respects to their elders past, present and emerging. This is a terrific agenda that Deakin has put together. I want to acknowledge everyone on it, some of whom are here, some of whom I suspect are going to arrive over the course of today. I particularly want to acknowledge Nicole Higgins, a long way from home, the President of the College of General Practitioners, and Liz Devaney, the head of the Consumers Health Forum, the peak body for patient voice in health, both of whom were really terrific, constructive members of the Strengthening Medicare Task Force. So thank you for that, and also the work that you continue to do. I see Nicole Bartholomew is on your agenda. Her work and the work of Co-Health is a real beacon, if you like. Victoria has been able to retain some of the terrific reforms, particularly of the Whitlam government in community health. And we learn a lot from that at a federal level. And I want to pay tribute to Nicole, to Catherine, who was such a calm, articulate voice over the last 4 years for the Australian community, particularly at some of the more frightening phases of the pandemic. Thank you for that and for the work you have agreed to undertake. You might be regretting it now, but the work you've agreed to undertake as part of the COVID inquiry. I know Liam Byrne is going to join you at some stage from the ACTU, and an important part, an important part of the history, as Matthew said, of universal health insurance was the advocacy of the union movement. They were determined to see Medibank return in the event of the return of a Labor government in '83 and pushed very hard for it as a central feature, perhaps the central feature of the social wage in the accord that was negotiated between the ACTU and the Labor Party, originally under Bill Hayden's leadership, but then to be implemented by new Prime Minister Hawke. So thank you for the work of the trade union movement. Mark Cormack is joining us, I think, virtually a little later. His work in the scope of practice area is terrifically important for the durability of particularly our primary care system in the long term. So I thank him as well. Former Prime Minister Gough Whitlam was a man with a mission, many missions actually, but one maybe stood out above all of the others, and that was the creation of universal health insurance. From 1967 onwards, after being inspired by two genuinely brilliant health policy experts, John Deeble and Dick Scotton, he stumped the country, making the best case that he could for his proposed scheme. It's said that a very grubby, well-thumbed copy of Scotton and Deeble's blueprint, the New Testament of his crusade, never left his briefcase. Whitlam was motivated by a moral imperative as old as social democracy itself: healthcare free of cost for everyone. He was also incensed by the sheer irrationality of the existing Menzies-era health insurance system. Though system is probably the wrong word, mess was really a more accurate description. One of the many stories that he used to tell on this never-ending barnstorming policy tour involved his Comcar drivers, George Bevitt and Bob Millard. Gough had discovered that they both paid twice as much as he did for family health cover, despite the fact that he earned 4 or 5 times their wage. They paid twice as much precisely because they earned 4 or 5 times less, because that's what the mishmash of tax concessions and subsidies that substituted for a genuine system had created. How many millions of Australians, he worried, found themselves in the same situation as his Comcar drivers? Worse, Gough wondered, how many millions had no health cover at all? In Gough's mind, it was a public policy obscenity that simply had to be righted. In 1969, having made Medibank front and centre of Labor's platform, he took the party to within a whisker of winning government, the 7% swing and just 4 seats shy of a majority. 3 years later, of course, Medibank helped him go all the way to the lodge, and the rest is history. Universal health insurance was born, but despite Gough's indisputable mandate for it, it did not have an easy delivery. Opposition was fierce, just as it had been when the Attlee government in the UK tried to introduce the National Health Service after the Second World War, as well as after Ben Chifley tried to do something similar here. The usual suspects were involved, led by an alliance between the Liberal Party and the Doctors' Associations, particularly the AMA. Of course, there's never any party without punch, as they say, and true to form, the then Queensland Premier, Joh Bjelke-Petersen, was soon comparing Medibank to the biblical flood, to the eruption of Vesuvius, and to the sinking of the Titanic. It's a good thing Joh was not given to overstatement. Spurred on by the AMA and the General Practitioners Society, the incoming Fraser government dismantled Medibank with a program of cuts and neglect. Fraser changed the scheme so often that it became incomprehensibly complex and simply out of reach for millions, relegating a scheme that had once, albeit for a short time, provided health cover to all, to little more than a safety net for the most poorest in Australia. In the world of Australian health policy, it was a history that didn't repeat so much as echo. The Pharmaceutical Benefits Scheme, too, had to fight off the same unholy alliance of Conservative politicians and the then British Medical Association before it finally became law in 1948. It's a fight that Labor has been having literally for decades. The Medicare we know today came from a simple 4-word pledge in Bob Hawke's 1983 election speech. Labor will restore Medibank. Remarkably, it was in place just 10 months after that historic election victory. When you think about it, that is an amazing public policy feat. A telling reminder, frankly, to all public policymakers today of the benefits of simplicity, clarity, and downright reforming intent. Today, the Australian people overwhelmingly support Medicare, and with good reason. In fact, the same reasons they supported it when it was before. I have with me today a copy of the letter from the pack of information that Prime Minister Bob Hawke sent to every Australian to mark Medicare's creation. And it says, Medicare is not only a cheaper and simpler system, it's also a fairer system. It's cheaper for Australians and it's cheaper for Australia. A system which will lower our inflation rate, and it did, by reducing the cost of living of most Australians. As the past recedes from memory, it's easy to forget just why Medicare was so desperately needed. Universal healthcare had been one of the great dreams of social reformers right around the world in the 20th century, including here in Australia. The state of healthcare available to people of little means was a global moral scandal. What could better express the promise of a better society than the idea that every person, rich, poor, or in between, could receive potentially life-saving medical care based on the principle of need and need alone? Whether you're a messianic Prime Minister or just his humble Concar driver, you deserved equal treatment. Medicare's animating impulse was therefore moral, but the need for it was brutally practical. Before Medicare, 2 million Australians had no health cover at all. It's the equivalent of 1 in 7 people back then who lived with the daily risk and the worry that healthcare might see them lose their house or bankrupt them altogether. They were low-income earners, including families with children who earned just above the threshold for a concession card and government health care, but couldn't afford private health cover. 3 out of 5 families without cover pre-Medicare said that they just simply couldn't afford it. 3 out of every 5. What's worse, an additional 500,000 Australians were eligible for a concession card and government-funded health care, but the system was so complex and so cumbersome that instead they were still paying for private medical and hospital cover. In a stroke, Medicare did away with this unbelievably complex, inequitable, and frankly irrational state and federal mishmash of subsidies, which made healthcare a source of frankly financial and emotional anxiety for so many Australians. Anxiety because by not having health cover, those 2 million Australians were rolling the dice every day, taking calculated risks with their lives, saying to their partners, look, honey, I think it's just a cough, just indigestion, just a headache. I don't think it's serious. I think it's probably not. At least I hope it's not. It's important to remember that illness back then for such people could mean losing their house, could mean being declared bankrupt. Indeed, before Medicare, unpaid medical bills were the leading cause of bankruptcy in Australia, the leading cause. After Medicare, medical reasons, unpaid health bills, were removed from the list of possible bankruptcy reasons because it simply ceased to be an issue overnight. That's how real and how consequential the lack of universal health insurance was. Working class or middle class, it didn't matter. So many Australians were having to throw the dice. And this alerts us to something absolutely crucial to understanding Medicare's continuing popularity. Medicare was not, never has been, a welfare system just for people who lack the means. It's a system that benefits every single Australian, no matter where we live or how much or how little we earn. And it's no wonder, frankly, Medicare took off like a rocket. By the date of its introduction on the 1st of February 1984, 40 years ago today, as I said, just 10 months after the 1983 election, 92% of the population had responded to this letter and the terrific TV ads that Bob Hawke filmed. You should have a look at them. We'll have them on the website. 92% of the population had signed up for Medicare. 6.5 million of those iconic green and gold cards had already been issued. Doctors' groups were still opposed to much of the scheme, but especially what I describe as its beating heart, bulk billing, proving that history repeats, first time as tragedy and the next time as farce. The AMA instructed all doctors not to bulk bill their patients, sending letters, running ads, and threatening a national strike in public hospitals, all ultimately to no avail. Nothing succeeds like an idea whose time has come, and Medicare proved to be a remarkable success, with steadily rising bulk billing rates providing fee-free GP consultations to Australians who needed them most, backed by free treatment in public hospitals. In the first full financial year that Medicare operated, 45% of Medicare services were bulk billed. 4 years later, that had increased to 55%. A Health Insurance Commission survey at that time found community support for Medicare was at a 71% high, with just 12% saying it should be abolished. And remember, at that time, the alternative government was still pledging a policy to abolish it. It was widely popular, but the Conservative side of politics still had to get the memo, some for frankly a very long time. The father of the modern Liberal Party, as I describe him, John Howard, was so opposed to public health insurance that he opposed both Medibank and Medicare. As opposition leader in 1986, he said Medicare was enormously expensive, hopelessly inefficient, a sham, and he promised to pull Medicare apart. He called bulk billing an absolute rort, and in 1986, he promised to abolish it. When he became Prime Minister in 1996, despite claiming Medicare was safe, John Howard began a program of cuts and neglect that would try to destroy it, with a flank attack that hit its beating heart, bulk billing. By February 2004, as Medicare turned 20, bulk billing had fallen off a cliff. From 80% in 1996, the rate of bulk billing for GP visits had fallen to just 67%, from 4 in 5 to just 2 in 3. And in 2007, it fell to another Labor government to save Medicare and restart that beating heart again. By 2013, when we lost government, Labor had restored bulk billing to a new record high, with 82% of visits to the GP bulk billed. Later that year, of course, Peter Dutton became Health Minister. He looked at the record high bulk billing rate that he inherited from Labor and famously lamented that there were, in his words, too many free Medicare services. So Peter Dutton began another program of cuts and neglect to deal with that, trying to do away with bulk billing altogether by introducing a tax on every single visit to the doctor by every single Australian. And when Labor and Parliament managed to block that, with the strong support of doctors' groups, I must say, Peter Dutton and the coalition froze the Medicare rebate for 6 long years, ripping literally billions and billions of dollars out of the primary care system. He also, of course, tried to jack up the price of medicines by up to $5 a script. It's no wonder, really, that Australia's doctors voted Peter Dutton the worst health minister in the Medicare era. But what followed was a program of calculated neglect. Recommendations from experts were ignored. Strategies were announced, but then not followed up with genuine investment. My health record stagnated, its implementation bungled, and its software full of bugs. When we came back to government, it essentially hadn't shifted from the software we introduced in 2012. And on the rare occasion that a Liberal health minister was prepared to deviate from that neglect, they were usually blocked by their own party room. Like when my predecessor, Greg Hunt, to his very great credit, introduced a regulation to ban the import of vapes and e-cigarettes just as that market was starting, he was rolled by his own party room in a matter of days, and his import ban had to be repealed. And we've seen what has happened since. Another reform not implemented at the cost of the future health of potentially millions of the youngest members of our community. Peter Dutton's freeze on the Medicare rebate would stand for 6 long years, and by the time of the 2022 election, general practice was, to use words I've used on many occasions, in its most parlous condition in 40 years. The Morrison government had claimed that bulk billing was at nearly 90%, but this was a clear misrepresentation, boosted artificially by the inclusion of millions and millions of temporary COVID measures. The reality was that by 2022, it had never been harder and never more expensive to see your GP. Bulk billing was in sharp decline, and public confidence in our public health system had fallen a full 10 percentage points. The signs of distress, as people in this room know, were simply everywhere. Between 2018 and 2022, the proportion of adult concession card holders, pensioners and card holders, that had every single visit to the GP bulk billed had fallen by a full 5 percentage points. And that slide, when we came to government, was, if anything, accelerating. Pensioners, people on disability support, Australians on income support, people caring for a sick or disabled loved one, families on the lowest incomes, the people with the greatest need for healthcare and the least capacity to pay, exactly the kind of people that any politician with a heart would want to work with. But because of Peter Dutton's freeze to the Medicare rebate, it just wasn't happening. Well, we're determined to change that. In the May 2023 budget, the Albanese government delivered an historical $6.1 billion package to strengthen Medicare, including the largest ever investment in bulk billing. The tripling of the bulk billing incentive for more than 11 million Australians took effect on the 1st of November. It was a measure advocated strongly by the College of GPs, I'm very pleased to say, and one that was welcomed at the time we delivered it as a game changer. 5 million children under the age of 16, 7 million adult concession card holders and pensioners should now find it easier to see a bulk billing doctor. These patients account for around 3 out of every 5 visits to the GP, and in some communities like regional Australia, much more than that, meaning a very significant increase to the average income of general practices. For a doctor in a major city like this, the Medicare payments they now get to bulk bill these patients for a standard consult, the total income for a standard consult bulk billed has increased by 34% on the 1st of November. And for a doctor in rural and regional Australia, Medicare payments for that sort of consult have increased by as much as 50%. In the Hunter, Dr. Yasser Samara Singh said it was a lifeline. And in the Northern Rivers of New South Wales, another Dr. Ken Stockley told us it's going to encourage those that have recently changed to private billing to go back to bulk billing. And even in these early days, just a couple of months into the new incentives, that is exactly what we're seeing right across the country. Clinics everywhere making that shift. Today, I can announce that across the country, the GP bulk billing rate has risen by more than 2 percentage points in just the first 2 months since we tripled the bulk billing incentive on the 1st of November. 360,000 additional trips to the GP in just those 2 months that were bulk billed compared to the pre-1st November rate. Hundreds of thousands more bulk billed visits, saving Australians many, many millions of dollars in gap fees in just those 2 months alone. People in rural and regional Australia have particularly benefited, with more than half of those additional bulk billed visits taking place outside of our major cities, including, I'm really happy to say, in some of the regions that had some of the lowest rates of bulk billing. Tasmania, for some reason, has always had low rates of bulk billing. Their bulk billing rate in November and December went up by almost 6%. Regional Victoria are up by 5%, including Bendigo up by 8%. The Central Coast in New South Wales and the Hunter have always had much lower rates of bulk billing than just up the road in Sydney. Western Sydney has bulk billing rates in the high 90s%, but the Central Coast saw their rate increase by almost 5%, as did the South Coast in New South Wales as well. This is not just a benefit for the hip pocket of Australians living in those communities, it's also important for their health, because we know that affordability can be a real barrier to the ability of people to go and see their doctor when they're worried about their health. It's good for hip pockets, it's good for their individual health, and it's good for the health system. To mark the 40th anniversary of Medicare, I want to say that the era of calculated neglect of our terrific universal health system is now over. A new era of strengthening Medicare has taken its place. And as I mentioned, Bob Hawke created Medicare with just 4 simple words in 1983: Labor will restore Medibank. And I have 4 simple words as well: Labor will strengthen Medicare. That work has already begun to return our cherished Medicare to its rightful place as one of the world's most envied public health systems. The Strengthening Medicare Task Force's recommendations are being speedily implemented. Again, I want to thank Nicole and Liz for their work on that task force, as well as the $6.1 billion that we've injected to strengthen Medicare and to save bulk billing. We've also reformed the pharmaceutical benefits scheme, cutting the maximum co-payment, particularly for general patients, reducing the PBS safety net threshold, again, particularly for pensioners and concession card holders, and delivering 60-day prescriptions for 6 million Australians on common medicines for a chronic or ongoing health condition. To address the growth of more complex and chronic health conditions, we've created a new Medicare rebate for consults that go longer than 60 minutes, again, a position strongly advocated for by the college. Workforce incentive payments have been increased by up to 30% and indexed for the first time to allow GPs to build bigger, stronger multidisciplinary teams, including practice nurses and allied health professionals. And we're encouraging the entire workforce to work to their full potential, whether it's nurses, pharmacists, or allied health professionals. In a global health workforce shortage, which is going to go on for a while yet, we need everyone working to the top of their scope of practice. As part of bringing Medicare into the 21st century, we want to see the My Health record system used to its full potential, with patients in control of their own information and all clinicians uploading to the record. No matter where a patient accesses services, data on their health history should follow them, subject, of course, to their consent. And we're going to make My Medicare the basis upon which we build a stronger and more personalised universal healthcare system, with high-quality care from multidisciplinary teams of medical experts that is tailored to the needs of each individual patient, starting, first of all, with priority groups. This is working too. As of a fortnight ago, more than 5,500 general practices and more than 700,000 patients had registered to My Medicare, which is designed to scale up and take on greater functionality over time. The first of 2 My Medicare blended funding packages will also become available in the middle of this year. The first will be targeted at the nearly 10,000 patients who present to hospital emergency departments more than 10 times every year. And the second will be targeted at the nearly 200,000 Australians in residential aged care, with incentives for doctors to provide regular visits and care planning for people in their aged care facilities. My Health record and My Medicare will together take Medicare into the future. But modernising Medicare is not just about large-scale headline-grabbing reforms alone. The complex nature of modern healthcare means it must involve a myriad of smaller improvements that are potentially life-changing and life-saving for many people, delivering care faster and more efficiently when and where people need it in their own community. A great example is our almost 50 million chronic wound care initiative, which was so strongly advocated by a range of stakeholders, including the AMA and Wounds Australia. It will provide fully subsidised wound consumables products for people aged 65 and over, and for First Nations Australians 50 and over who have chronic wound conditions and diabetes. It will deliver wound consumable products to general practices and to people's homes free of charge. It'll improve chronic wound management training for healthcare professionals, particularly nurses, and include an important public awareness campaign, helping to keep people out of emergency departments because their wounds have deteriorated. A faster service with less bureaucracy, delivering care more efficiently, freeing up resources to be spent on things like illness prevention. That illustrates the direction on which Medicare must increasingly go. We've also initiated a review to investigate ways to more equitably distribute doctors, nurses and other allied health professionals right around the country, because Medicare can't be universal when it's hundreds and hundreds of kilometres and many hours of travel away. Then there are our cheaper medicines reforms, delivering the largest cut to the co-payment in the 75-year history of the PBS, saving Australians, general patients particularly, $240 million in co-payments last year alone, with more savings to come this year. On the 1st of March, another 100 common medicines will become available on a 60-day script, saving time, saving money for Australians with an ongoing health condition, and hopefully freeing up GP consults that can be used for other purposes. This is not just good for the hip pocket, it's also good health policy. A 30-day script made a lot of sense when chronic conditions were less common and more patients would usually attend their pharmacy with a short illness seeking a one-off course of medicine. A 30-day script doesn't make as much sense today when half of patients have a chronic condition and many of them are on the same medicine, not just for years, but sometimes for decades at the same dose or even for the remainder of their life. We simply can't strengthen Medicare for the 21st century without also strengthening that second pillar of our healthcare system, the PBS. So as we celebrate the 40th anniversary of Medicare, a truly nation-shaping reform, we must always remember that universal healthcare is not now, never has been a given in this country. It's been fought for. I'd obviously say by Labor and the Labor movement, but also by visionary health policy experts, by doctors, by nurses, and so many other Australians literally for decades, with High Court challenges, with protests and campaigns, and earlier on with referenda as well. In the face of sometimes savage assaults from lobby groups and vested interests, always struggling against cuts and neglect of those who, for what I see as irrational reasons, have never really accepted it. So we continue to take the hard choices to strengthen Medicare for the future. I fully expect that some will oppose those measures, just as the Liberal Party opposed Chifley's PBS in the 40s, Whitlam's Medibank in the 70s, Hawke's Medicare in the 80s, and more recently our 60-day prescriptions last year. But on the 40th anniversary, can we all just reflect that we owe the nation owes such a deep debt to Deeble, to Scotton, to Whitlam and to Hawke, to former Social Services Minister Bill Hayden, who did that work under Gough, and to Health Minister Neil Blewett, who did that work under Bob Hawke, and who remains the greatest health minister our country has ever had. But also to the countless many Australians who over those decades fought so hard to make the Medicare that we enjoy today such a reality, a system that genuinely changed Australia and delivers great outcomes to our country. Their legacy is immense and should never be forgotten. And today, on this day of celebration, we salute them all. Medicare and its beating heart bulk billing are here to stay. We've enjoyed them for the past 40 years, and I've got my vote on them being here for another 40 as well. Thank you very much. Now some gentle probing questions.
So Minister does have a few moments for questions. If you could just introduce yourself and where you're from. So Carolyn, please go.
Thank you, Minister. Carolyn Honourable, historian at Deakin University. So you possibly know that the NHS celebrated its 75th anniversary or birthday last year, and part of the celebration was a church service at Westminster Abbey. They have birthday cakes every year. It's mythologised and sort of sacred, maybe in the way that the Anzac legend is in Australia. My question is how important do you think public regard for Medicare is in terms of safeguarding it for the future? And do you think that in this era where some of our basic civic institutions and practices like democracy seem to be under threat, that there's some value in seeking to sort of tamper it more deeply into the Australian imagination?
Let me deal with Australia first and then come back to the UK experience. I'll deal with the UK first. Healthcare systems right around the world are under enormous pressure. The OECD does some work, some others do some work, but a piece in The Economist last year that had a big impact on me, I think stressed that there aren't good universal global measures of the performance of healthcare systems. But as they pulled together a range of different indicators, the common picture it showed was systems right across the world under enormous pressure. Now, part of that is demographic change that predates COVID. You know, we're getting older, we're getting more chronic disease. But the legacy of COVID is deep and it's going to be long. Healthcare workforces are exhausted. So many people deferred care whether that's cancer screening or simply going to their GP for chronic disease. So acuity is higher. And we've got some of those sort of structural shortages in workforce supply that I talked about as well. So all health systems are really, really straining. And the NHS, given that the UK had a very bad pandemic, is probably doing it tougher than most. You're right to say that the sort of place of the NHS in modern Britain is it's sort of iconic. And it played a really important role in Brexit, for example, I would say, rather misleadingly, but you know, it is hard to find anything that quite compares to the pride that the Brits have for NHS. But I think Medicare approaches it. I mean, I genuinely think, along with the age pension, perhaps this is the most important social program we have in the country, and arguably Medicare, you know, touches pretty much every Australian each and every year. So arguably it's more important. One of the things that's really worrying me is, I referred to this shortly in my remarks, that public confidence in our healthcare system has been on the slide. I've seen some data that includes public confidence in Medicare has come down sharply. You saw a peak, you know, a sort of rallying around the flag peak, I think, during COVID, but it has come down sharply. People are doing it really tough with cost of living generally. So gap fees and medicines costs and things are felt more sharply right now than I think they would in ordinary circumstances. So, I mean, that's really why I have, and the Prime Minister and others have tried to send a clear message that we have no more important, you know, agenda as a government than strengthening Medicare. And part of that's about instilling confidence in patients, and importantly in GPs and young medical graduates. We hope to become GPs, that they have a government in Canberra that cares deeply about the sustainability and those core principles of Medicare. But I am worried about public confidence in the healthcare system. People are finding it hard to get a doctor. They are finding it hard to pay the gap fees. We're not going to turn around either of those issues overnight, particularly the supply of doctors. As people in this room know, it's not something you can flick a switch about, although we are still an attractive destination for overseas trained doctors who are keen to move. So you know, we're being a bit jingoistic today, celebrating Medicare's birthday. There are cakes. I'm off sugar, so I didn't take the cake I was offered yesterday when I visited one of our urgent care clinics with the Prime Minister and the Queensland Premier. But, you know, we do want to give Australians, patients and doctors and other healthcare professionals confidence that, you know, to the extent they feel that there's been a slide in Medicare, whether it's affordability or access, we're determined to turn that around. I don't see that as in any way a slide in the importance Australians attach to universal health insurance. I'm very confident that that's strong and resilient. It's their concern about the performance of the system. And after 10 years of cuts and neglect, you know, it's our job now to turn that around.
My name is Edward Boyapati. I'm from Holistic Health House and General Practice. Minister, for various reasons, people are living longer. And consequence of that is that chronic diseases are increasing inexorably and likely to increase exponentially in the future, which means Medicare may become unsustainable. So why not consider other models such as MediSave, like they have in Singapore, which is medical savings account. Just as you have superannuation for retirement benefits, you have medical savings account for medical benefits. Why not consider that? Look, going forward and thinking of, for example, 40 years ago, no one would have expected that chronic disease would be such strong driver of medical services.
Well, you're right to a degree that the ageing of the population or the extent of additional life expectancy was not predicted. in the 70s or even the early 80s. If you look at the first population inquiries that had been done since the war, that were done in the 70s, there was a big focus on declining birth rate, but not much of a focus on additional life expectancy, because frankly, there wasn't much additional life expectancy. Surprisingly, the additional life expectancy had all accrued at the earlier part of life through survivorship of babies and infants, particularly, and good maternal health care. Additional life expectancy in the 50s, 60s and 70s hadn't really shifted, particularly hadn't shifted for men. So a 50-year-old in 1970 couldn't expect to live much longer than a 15-year-old in 1870. A 70-year-old in 1970 actually lived a shorter time than a 70-year-old in 1870, which is just extraordinary in spite of all the advances. And the reason, of course, was tobacco. The reason was smoking, but 3/4 of adult males back then were smoking. And it wasn't really until those advances in cardiovascular treatments in the 70s and the beginnings of the quit programs in the 70s that you started to see additional life expectancy for middle-aged and older-age Australians start to increase. And so you're right, 40 or 50 years ago, people weren't really focused on this expectation or projection that there would be a vastly bigger number of Australians in their 80s and 90s. That's really only something that we've appreciated over the last few decades. What Bob Hawke and Neil Blewett were dealing with in '84 was very different to the picture we face right now. They were dealing with high rates of tobacco smoking, high rates still of infectious disease. Presentations to the doctor were more about people getting an infectious disease or falling off the ladder, not about having diabetes or COPD or something like that. And that's really at the heart of our plans for rejigging Medicare, because the nature of Medicare, the way we fund it, the Medicare schedule itself hasn't really changed to reflect that very different patient profile that we have right now. And that, although there's been a lot of focus on the bulk billing incentive, that really, I think, is the longer term message out of the Strengthening Medicare report and some of the other elements of our budget last year. As to how we fund it, I wouldn't say that this thing is unsustainable in the long term. We still have a pretty efficient healthcare system. We sit at about the middle of the OECD in terms of healthcare spending as a percentage of GDP. Unlike many other developed countries that are really grappling with the economics of their ageing population, we are still going to have a pretty healthy economy over the coming decades. We've got a relatively good birth rate compared to Europe and many other countries, and we've got strong immigration. So that should keep our economy pretty prosperous and able to fund good healthcare systems. So I'm not as glass half empty as perhaps you are about the sustainability of our funding mechanism. The other thing about savings measures, we've thought about this a bit in relation to aged care, is that they take a long time to build up. We've seen this in super. Like, it takes decades to build up enough savings to fund your retirement or to fund aged care services that you might need, let alone to fund healthcare services. And it's really decades in the making, those sorts of systems. So we're not focused on that. We've got a pretty big job now, sort of re-gearing Medicare to reflect that very different patient profile you talk about. It involves strengthening the relationship between patients and their primary care provider, making sure there's good multidisciplinary teams. And I think that's one of the lessons from the NHS that we could take. I think they're much better at pulling together teams and utilising the skills of non-GPs as well as GPs who lead those teams. So that's more than enough, I think, for us to chew on over the coming years.
So we have time for one more question.
Yep.
So
thanks. Elizabeth Deputy from Consumers Health Forum. Thanks for that terrific presentation, Minister. You said that we don't have enough health professionals, and you mentioned that you're trying to improve the scope of practice for all our health professionals. As someone representing Australian consumers, we would say that we're also part of the health workforce. So whether it is we're taking our medicine, we're supporting a loved one, really interested to understand, given we know we won't have enough health workforce into the immediate future, what your government is going to do to ensure that every Australian has the health literacy to engage with the wonderful system we have, is able to do the self-care that perhaps is possible. Because right now what we see is a big difference between those that know how to use the system and those that have good health literacy and those that don't, regardless of the fact that the system itself might facilitate better health.
Terrific question, as always, Liz. And the work of CHF in making this case is critically important. That's not a handball to you.
I keep making it, Minister.
Good, very good, very good. We're at this, and you and I have talked about this a bit before, I think. We're at this really, globally, we're at this really interesting inflection point coming out of a once-in-a-century pandemic where people had become so literate in elements of health. Their deep literacy about the coronavirus, by vaccines, about different testing options, and so on and so forth. Is not entirely upside, and it did provide a platform for conspiracy theories, what I would describe as conspiracy theories with little basis in science. We're dealing with the impact of that still right across the world in a reduction in vaccination rates broadly, not just COVID vaccination, a really worrying decline, a number of quarters in a row now in childhood vaccination rates, including in First Nations communities, of really great highs. This is something the WHO has pointed to globally as a real downside legacy of COVID and of some of the rubbish, frankly, that proliferated on the internet around COVID. There is, on the upside, though, an opportunity for us to leverage the focus on health literacy that did come from that. In mental health, particularly, I've long said that I think Australia's system focuses on self-care much less than other comparable systems, much less than some of the global best practice standards by the WHO. There's more we can do there, and I think Australians want that. I think Australians want to be able to focus on their own care, often in partnership with their GP or their other treating practitioners. So, I'm really open to all of that. Part of the budget, as you know, was about increasing the capacity of consumer voices through the leadership of the CHF. The CDC, I think, which we would see as focusing on prevention or health promotion, as well as the sort of obvious role that people see a CDC having after a pandemic, also is an opportunity to increase literacy. I think what we've learned over recent years is the importance of targeting some of those messages as well. So if you look at the skin cancer messages that we've been running over the last couple of years, they haven't just been population-wide, one-size-fits-all messages. Last year and this summer as well, we focused on middle-aged men who I can say as one are bloody hopeless at protecting themselves. This year, we're just launching a campaign into 18 to 30-year-olds, really interesting cohort for me. I have kids in that age group. They've gone through all of their schooling, having sun smart messages drilled into them, but you see them on the beach now, completely uncovered, well, not completely, but pretty much completely uncovered, sun tanning in the way that we did with very poor information decades ago. So you're also recognising that you've got to target some of these messages and leverage those opportunities in a way is something I think we've learned in recent years too. Thanks, everyone. All the best for the rest of your day.